Welcome. On behalf of the faculty and staff of the Yale School of Public Health, I congratulate the members of the class of 2020. We are gathered together, albeit virtually, to celebrate your achievements, to acknowledge this milestone, and to thank the many others who contributed to your success. My colleagues and I welcome, thank, and congratulate all those who played a critical role in shaping the aspirations of all of our YSPH graduates. These special people include your parents and guardians and role models, your siblings, your grandparents, your extended family and friends, and for some of you, your spouses or partners and children. We appreciate this, and we are even more grateful for all the ways in which you help today's graduates develop into public health professionals. Thank you to all of you who have made this possible, the academic and life journeys of our graduates. Please accept our heartfelt gratitude, and we pause to applaud your contributions to our Yale School of Public Health graduates. Now, to the graduates. The past few weeks and this moment really bring to life the Yale University a Zoom institution meme, which has become a new reality for us. But we are not living in the Zoom because of the Rona. We are upholding our social responsibility to do what is needed to protect the health of our communities and to mitigate the spread of this devastating virus. More importantly, we are doing this collectively as the Yale School of Public Health. We're a strong community, and this has been evident in our efforts together since March and the beginning of your time at YSPH. COVID-19 is the defining public health crisis of our era, and you have studied to do the work that is most needed for the world, to heal, learn, and move forward. I'm proud of the way YSPH has pivoted to respond to the urgent needs of the present. Our community embodies strength, perseverance, and courage. Each of you has shown your commitment to public health and your resilience during this most difficult time. Public health represents the workforce, both public and behind the scenes, mitigating viral spread and illness. You are uniquely equipped to enter this public health workforce with a skill set that the world desperately needs right now. There are countless opportunities for you to alter the future for the better. We are more than zoomed out, and we are looking forward together. You have chosen careers in public health that are designed to help the world live healthier and happier lives. There has not been a time in our current era where your skill set is needed more than at this very moment. There are few vocations that have more potential for contributing to the public good and enriching the lives of so many. A public health professional can go to work each day knowing the difference that they make in our world. When people ask me about the best part of my job, I'm honest when I say it's the passion that our students bring to YSPH. Meeting our future public health professionals, learning about your accomplishments, plans, and aspirations, I have a tremendous sense of optimism for the future of the field. We have been honored to work with you and learn from you. Now I would like to acknowledge and thank Hua-Chi Lee for serving as this year's Student Marshal. After completing her Bachelor of Science in Honors Health Studies at Canada's University of Waterloo, Hua-Chi came to YSPH to pursue her MPH in chronic disease epidemiology. She continued to pursue her interests in public health modeling and in clinical oncology research. She's worked closely with the Yale Cancer Center and its Cancer Outcomes, Public Policy, and Effectiveness Research Center, which we call COPPER. Her summer internship at the Dana-Farber Cancer Institute in Boston has resulted in a publication in the Breast Cancer Research and Treatment Journal. This term, she completed her thesis on immunotherapy and survival outcomes in patients with autoimmune disease and advanced cancer. Hua-Chi participated both on campus and in the greater New Haven community. She served as a student ambassador, a peer mentor, and the SAFE Communications Chair, and through her work with the Yale Journal of Biology and Medicine, the Haven Free Clinic, and the Neighborhood Health Project. SAYPH, S-A-Y-P-H, is the student association of the YSPH. Most recently, she helped with YSPH's efforts in COVID-19 contact tracing. After graduation, Hua Chi is planning to attend medical school in Canada. Thank you for serving as this year's Student Marshal, Hua Chi. Thank you, Jose Marie Feliciano, for serving as our banner bearer. Jose is an MPH candidate in biostatistics. He's the 2019-2020 president of SAFE. In the past year, his research with Elizabeth Klaus in biostatistics has focused on social media innovations to improve neuro-oncology patient outcomes. He presented a paper entitled A Twitter-Based Network Analysis of Brain Tumor Social Media at the 2019 Society of Neuro-Oncology, the Yale School of Nursing, and also the Yale Day of Data. He was actually awarded a research presentation prize at the Yale Day of Data conference this past December. Last summer, he completed a data science internship at Merck, where he modeled the impact of patient assistance programs on medication adherence using pharmacy data. His other Yale achievements include a regression modeling teaching fellowship under Elizabeth Klaus, working to implement the curriculum with Jeremy Bradford from the Department of Physics. Jose has also conducted COVID-19 research with Sama Jarad in the Department of Medicine based on Twitter data, as well as nurturing STEM education. Now, STEM means science, technology, engineering, and mathematics, STEM. And this was in a community outreach with Lisa Calvo-Corresi in biostatistics. Thank you for serving as this year's banner bearer, Jose. This year's faculty marshal is Professor Leslie Curry. Professor Curry is Professor of Public Health in the Department of Health Policy and Management. She's Associate Director of the Center for Implementation Science at the Yale School of Medicine. She's a lecturer at Yale College, and she's core faculty at the Yale Global Health Leadership Initiative. Leslie's research and teaching focuses on management, culture, and organizational performance in diverse healthcare settings, both in the U.S. and internationally. She's especially interested in the development and scale-up of innovative, evidence-based health practices, programs, and policies. She regularly collaborates with government agencies and healthcare providers in these efforts. Leslie is an internationally recognized expert in qualitative and mixed methods. Many of us use her book. And she lives in Killingworth, Connecticut with her family and a menagerie of very interesting farm animals. Thank you for serving as this year's faculty marshal, Leslie. It now gives me great pleasure to introduce Helen Moore, who has been chosen by her peers to deliver this year's student address. Helen is being awarded her MPH degree in health policy. She graduated from Binghamton University in 2018, where she earned her bachelor's degree in English literature and psychology. She decided to pursue her MPH after interning in Los Angeles through the CDC and working at a nonprofit to serve immigrant and refugee communities. In her first year at YSPH, she immersed herself in health policy and worked on a variety of state legislative efforts, including expanding health services for undocumented children. For her summer internship, she was selected as one of Yale's Presidential Public Service Fellows and worked at Neighborhood Housing Services, where she helped to prevent the demolition of 2 historic buildings and advocated for non-discriminatory zoning policies. During her time at Yale, she demonstrated her commitment to her peers as a teaching fellow in 5 courses and as one of the YSPH Diversity Ambassadors. It is an honor and delight to invite to this virtual podium our 2020 student speaker, Helen Moore.
Hello, faculty, friends, family, and fellow graduates. Today I'm here before you to congratulate the Yale School of Public Health, class of 2020, and reflect on our journey together to offer some semblance of closure. When I sat down to write this speech, I thought about what I would like to hear as an MPH student finishing my degree amid the COVID-19 pandemic. This landmark moment has demonstrated to the world the vital importance of public health. You will probably never have to explain your degree again. And while I considered centering my speech around the pandemic, I realized that as public health professionals, we'll be living through its legacies for decades. So I refocused my scope and decided to dedicate this speech to you all, my peers, and all the hard work you have done and will continue to do beyond 47 College. And with that said, there are moments in life where you can't help but be just a bit corny and sentimental, and graduation speeches are one of those moments. So please brace yourself for some cliches, corny jokes about YSPH, and maybe a Harry Potter quote. A year ago, no one would have predicted that we'd be finishing our degrees at home, on our computer, camera off, and fully in our pajamas. But whether we have spent our time in self-isolation, diligently finishing our thesis, or baking bread while on a Zoom call, I want you to know that I am so proud of you. I am proud to be part of a family of public health students that have consistently advocated for marginalized communities and pushed for change even in the face of opposition. As Dumbledore once said, it is our choices that show what we truly are, far more than our abilities. To my fellow classmates who choose to speak up, who choose to pursue a life dedicated to public health, and choose above all else to seek justice, I am proud and appreciative of you. 2 years ago, you all made the decision to enter this field before public health was at the forefront of every newspaper. I myself struggled with this decision, torn between continuing my education in American literature or entering the new world of health policy. And yes, before you ask, I am one of the so-called poetry majors who will never touch R again in my life, although my resume will tell you that I am proficient. But I chose to get my MPH in health policy because I want to improve the lives of others. Public health is inherently social justice. My classmates have demonstrated this time and time again, advocating for a core curriculum that incorporates these values throughout. Public health dismantles the idea that social justice is a monolith. Even throughout our school, we have folks who advocate for maternal child health, improving health infrastructures abroad, committed to reforming safety net programs, and so much more. This is all to say that public health is multifaceted, and the many faces of justice sit before me today as soon-to-be Yale graduates. Now that the journey to my MPH is ending, I can say with certainty that I made the right decision. My time at Yale has been filled with professors who will call you just to see how you're doing, friends who will stay up late with you on campus drinking wine, and lots of free food. This decision brought me moments of inspiration from peers who are on the ground organizing to those creating communities abroad. It's our choices that have brought us here all today and allowed us to cross paths in the windowless dungeon we call LEPH. And it is the collection of our choices now and in the future that will forge our paths towards changing the world and saving millions at a time. We might be ending our time at Yale, far from New Haven and the friends we've made along the way, but our time as public health professionals is just beginning. Although I want to avoid the cliche of our lives are only just beginning, you can't run from the inevitable. We are now entering a world where we will be needed more than ever. This pandemic has deepened the cracks in our public welfare programs and highlighted the need for drastic changes to our healthcare system. There is no better time to continue making the choices that brought you here today and continue your commitment to vulnerable populations. I hope you've taken this time to reflect on your own journey as a public health student, the choices you've made, and the reason you came in the first place. Before we end, I want to take a moment to thank those who have supported me along my journey and encourage you to do the same today. Thank you, Dad, for always pushing me to think critically, and Mom for being my biggest fan. Thank you to my siblings for always pursuing their dreams and encouraging me to do the same. To my friends for all the late nights in Wienerman and shared Delenia's pizzas. And finally, to the YSPH Health Policy Department for all the laughs and life lessons on the third floor. We've worked hard to be here today, and I know we will continue building on the lessons we've learned at YSPH and striving for the many faces of justice. To my future health policy analysts, epidemiologists, PhDs, biostatisticians, and public health researchers, thank you for all your hard work today and forever. And congratulations, YSPH Class of 2020.
It is now my privilege to introduce our distinguished 2020 commencement speaker, President Elizabeth Betsy Bradley. We are proud to have our own graduate and former faculty leader as our speaker in the academic year that has honored the 50th anniversary of the first women students at Yale College and also the 150th anniversary of the first women students in Yale's graduate and professional schools. Prior to becoming the 11th president of Vassar College in 2017, Professor Bradley was on our faculty here at YSPH. She had many roles. As the director of the Brady Johnson program in Grand Strategy at Yale, she led a university-wide interdisciplinary program primarily for undergraduates with the goal of training emerging leaders. The program teaches a comprehensive approach to achieving large ends with limited means, drawing from disciplines such as history, political science, and classical literature to address a wide range of current-day challenges. These challenges include security, economic inequality, global health, and climate change, among others. The program reflected Betsy's quintessential multidisciplinary scholarship. In her role as head of Branford College, President Bradley was responsible for the intellectual and social life of the Branford community. She and her family lived on campus with 450 undergraduates, developed programs to bring faculty and visiting scholars to this college, and fostered a strong community culture. Branford squirrels, that really is their mascot, could find Betsy tossing a baseball with her son or on the squash courts in the evenings. Betsy served on multiple university-wide committees pertaining to student life. And here at YSPH, Professor Bradley was highly regarded for her international work as founder and faculty director of the Yale Global Health Leadership Initiative. Betsy spearheaded educational and research programs in China, the United Kingdom, Ethiopia, Ghana, Liberia, Rwanda, and South Africa. Betsy led teams that helped transform Ethiopia's healthcare system, enhancing the quality of hospital management and the availability of primary care. Prior to her work at YSPH, Betsy was an administrator at Massachusetts General Hospital, where she helped lead the first generation of quality improvement efforts. This was a part of the National Demonstration in Quality Improvement in Healthcare program, the inspiration for much of her subsequent research. President Bradley grew up nearby in New Britain, Connecticut. She focused on economics and art history as an undergraduate, graduating magna cum laude from Harvard University in 1984. She earned an MBA from the University of Chicago in 1986 and a PhD in health policy and health economics from Yale University in 1996. Betsy and her spouse, John, have 3 young adult children, and graduates, faculty, staff, families, and friends, please join me in a warm welcome for President Betsy Bradley.
Hello, graduates of 2020. I am so happy to share this time with you. Congratulations. This is really a momentous occasion for you, and it's a momentous occasion for me, too. Just 25 years ago, I was sitting where you are, about to get my degree in public health at Yale. I was getting a PhD in health economics, and I remember being kind of relieved that was my concentration because a lot of people didn't really know what public health was. And they sure knew what economics was. But how different it is today. On your commencement, with the world facing the worst pandemic since 1918 and forecasts of more pandemics to come, with the changing climate, the melting of the Arctic permafrost, and the human encroachment on rainforests and other natural boundaries. So let's talk for a minute about where we are in terms of public health and its relevance to the roles that you will assume in your life. I often get asked whether my background in public health has helped my role as president of Vassar, particularly during this pandemic. My public health background has, in fact, helped. As I understand our epidemiologic data and related biases more easily, I've been through medical and public health crises before, and I have some sense of how the public health system gets mobilized or not. And I've learned at the School of Public Health that everything is connected to everything else. But I also have to confess that public health has let us down in this pandemic. For sure, most of us in leadership with public health backgrounds and many public health experts throughout the country believed that we would follow an accepted template for responding and having testing early, maybe in February or even January when tests were available globally. So while we were alert and concerned in January, we were still secure knowing testing and isolation could contain the virus. But week after week passed, February, even March, without testing. The virus, which we still do not completely understand, and the risks became overwhelming, and here we are in a pandemic. When it's over, and nobody can say when that will be, we in the U.S. will have devoted and sacrificed trillions and trillions of dollars, and lost maybe as many as 80,000 lives in the battle. One might say that the U.S. has taken a very medical approach to this pandemic, relying ultimately on the development of medications to address what is a public health problem. As has been shown in so many other instances of health threats, over-reliance on this reactive medical approach is very expensive and not that effective. Time and time again, the U.S. health policy decisions have privileged medical care over public health systems and emergency preparedness. Think about it. About $275 per year per person is what we spend on public health. That is only 2.5% of all of the healthcare dollars. It's simply not enough. Not enough for the core investments that we need to protect human health in this country or globally. The U.S. healthcare spending is more than double that of other countries like us. And those countries seem to have weathered this virus much better than we have. How can that be? Shouldn't greater investment equate in better outcomes and longer lives? Well, it turns out that we have not always invested in the right things, at least the right things to combat a pandemic. I want to focus on some of the investments we need to make, which are not complex, and in fact, they're nothing more than common sense. First, we need the brightest and most creative minds in communications and social media to provide a constant flow of engaging information about health risks and opportunities, tailored to different ages and needs. I understand health communication is a renewed focus at the School of Public Health with the teaching of alumnus Dr. James Hamblin, who's a reporter for The Atlantic. I believe this area is wide open for you new graduates who understand how to be influencers on social media. Having information in real time about health risks and opportunities in formats that are consumed regularly by everyone is key to proactively protecting our health and transforming all that rigorous epidemiologic data into meaningful tidbits that the general public can consume is truly a challenge for our future. You, when you graduate, will be competing with misinformation, sometimes coming from not really knowing what a reputable source is, to an audience that maybe is a little cynical about what the media is telling them, but your degree has equipped you for the complex world of health communication. Second, we need the capability to quickly scale up testing, ideally home testing in public health laboratories to make universal and regular testing feasible. And I know Professor Albert Coe is co-chairing a group looking for safe ways to reopen Connecticut with adequate testing and follow-up. A big part of this is science, but it's also logistics and, of course, community action. To shift expectations and practices of large populations to undergo testing regularly and quickly, that takes a lot of skill, and that is what a public health degree can help you motivate and change. And last, we need coordinated data collection and analysis to enable timely and accurate contact tracing and follow-up to contain outbreaks at their source. I believe Professor Nicolai here at the School of Public Health is working to develop a 100-person, mostly students, volunteer corps to help do contact tracing on behalf of Yale Health, Yale New Haven Hospital, Yale New Haven Department of Health, and the Connecticut Department of Public Health. That is a nice collaboration between academics and the city and state public health departments. And such resources should be regularized in our national public health workforce, something that you can work at when you graduate. So these are all technical investments: health communication, testing, diagnostics, coordinating a workforce that can do contact tracing and response. They are the bread and butter of public health and emergency preparedness, and yet tragically underfunded and underappreciated. I mean, whose parents ever say, "We want you to grow up and be a contact tracer or a health communicator"? Not likely, even though those are the roles that protect all of us. But now, there's something more, something also lacking in our current public health and medical care system, and that is leadership. Here I want to reflect on an innovative study led by Professor Leslie Curry, who is the faculty marshal today at these ceremonies. The study is called Leadership Saves Lives. The hypothesis going into the study was that leadership capacity within hospitals could be prospectively developed and would be associated with reductions in risk-standardized mortality rates. This mixed method study was a 2-year follow-up and had interesting results. 4 out of the 10 hospitals exposed to the intervention, which include in-depth training, development sessions, team building, 4 of the 12 showed marked improvements in their leadership and organizational culture. And these hospitals, guess what, saw reductions in risk-standardized mortality rates. In the hospitals that successfully reduced mortality rates, staff talked about several pieces that differed from the other hospitals. They talked about unearthing new skills on the team that they never knew was present, like physicians recognizing the value of EKG techs, or nurses and technologists seeing their roles as complementary, not competitive. Additionally, successful hospitals found ways to encourage staff from different disciplines to participate fully and authentically in quality improvement efforts, allowing low-power staff to feel more secure, providing critique and creative ideas to the group. And last, staff at successful hospitals learned how to manage conflict effectively. It was funny. Staff at poorly performing hospitals noted feeling bored or withdrawn from quality improvement project teams. They were fatigued. And if they weren't bored or withdrawn, they were slightly irritated or angry, blaming someone or being blamed. This was quite a contrast at the successful hospitals, where staff talked about having errors that got analyzed in ways that uncovered systems and structures that could improve for next time. Why is leadership so important to today's struggle with the pandemic and to your commencing into the field of public health? Although I argued that the calamity of COVID-19 is due to the inadequate intelligence about the virus and its spread, as well as deficient testing, the current mess is so much more a function of ineffective leadership. Let's go back to the evidence about leadership efforts that save lives. Convening groups of different disciplines, ensuring each is comfortable participating fully, even to speak truth to power, and resolving conflict in ways that are analytic, focused on discovery of misdesigned systems and structures, and keeping people engaged, not in blaming each other, but in collaborating with others to improve. To prevent and mitigate the devastating effects of pandemic threats, agencies such as the CDC, the FDA, HHS, just to name a few, need to work together, guided by accurate and real-time data and without blame. There is no room for othering. There is no room for ego and bragging rights. There is only room for evidence-based, painstakingly careful analysis and strategy, and strong leadership to keep teams pulling in the same direction. We see these capabilities in some states. I'm actually proud to be from New York today. But not enough at all levels of government. Now, the leadership I've been talking about is not the traditional leadership model that we often have in our heads based upon cultural norms in the United States. The research did not find a great person who led the hospital with intelligence and charm to successfully change systems and save lives. Rather, the research found people from all parts of the organization who were inclusive, who sought ideas from every area, who developed trust and transparency, and who shared power among the team. Many of these ideas about leadership were formed and informed by my global health work I've done around the globe with very few resources. I know Yale is celebrating 50 years of women this year, and so I will put in a plug, in particular, for how women around the globe have demonstrated new norms of leadership. Many women who had seen suffering and disease in their communities and had concluded they could no longer accept things the way they were. Health extension workers in Ethiopia and community health workers in Rwanda, who could no longer accept that women died from what should be a routine birth. Women in rural China who believed that there could be basic hygiene, that hospital infections could be reduced, and women in Ghana who refused to accept the lack of treatment and stigma for people living with mental illness and advocated for a state-of-the-art national mental health policy. And now to you. You might not fashion yourself to be a leader, but you have leadership in you because, like my colleagues around the world, with this public health degree, you have taken a step to say, there is unnecessary suffering and disease, and I will do something about it. You know the power of working in groups. To the degree that leadership is the property of a system, not of an individual, you can be part of the leadership capacity of any organization, any community effort, and any agency you join. Remembering to focus on attracting a diverse group of people and roles with complementary skills to the table, ensuring the group working atmosphere is one in which low-power individuals feel they can speak up and participate, and learning to resolve conflicts in ways that deepen engagement and help uncover paths to improvement. All this is leadership, and all this saves lives. At the micro scale of a hospital or at the macro scale of a country facing a pandemic. Given our shared field of leadership and public health, no matter what your role is in it, you are called to lead. You have chosen to pursue one of the most important fields for our time. To graduate from Yale with a degree in public health in the middle of a pandemic is an enormous achievement for you and all of your family and your friends who have gotten you to this place. We're not physically together, so I cannot ask you to look around at all your peers and supporters in the room and say thank you. But let's have a quiet moment and think of all of those who have carried you to this place, and think of your gratitude. What a wonderful day. Congratulations to the class of 2020.
The Henry J. Chauncey Jr. Inspiration Award was established in recognition of Mr. Sam Chauncey, who developed our program in health management and fostered its close collaboration with the Yale School of Management. A former secretary of the university and distinguished member of the Yale and New Haven communities, Sam has been both an agent of change and a dear friend of YSPH. This award was initiated by the Health Management Program Class of 1999 and is now supported by the Dean's Fund for Education. It is given to the graduating health management student who most exemplifies innovation, integrity, leadership, and community service. This year's recipient of the Chauncey Award is Tal Gurovich. Tal has previously worked within the United Kingdom healthcare industry and has a background in change management and communications. She has a bachelor's degree in philosophy, politics, and economics from Warwick University in the United Kingdom. Congratulations, Tal. Last year, we lost Dr. Lowell Levin, Professor Emeritus and Lecturer in Public Health from the Department of Health Policy and Management. Professor Levin was a dear friend to many, an alumnus, and the first head of the YSPH International Health Division. He passed away last April 2019 at the Connecticut Hospice in Branford, surrounded by family and friends. The Lowell Levin Award for Excellence in Public Health is awarded to a graduating student whose work addresses health promotion and global health. The recipient is selected based on their internship experience and overall academic record, as well as their academic leadership and community engagement. I am very pleased to announce that the Lowell Levin Award for Excellence in Global Health has been awarded to Shadrach Osai Frimpong, an advanced professional MPH student in the Global Health track. Shadrach serves as a student editor for the Yale Journal of Health Policy, Law, and Ethics. He is the founder of a non-governmental organization in Ghana called COCO 360. COCO 360 is on a mission to achieve equity in rural communities. Its pioneer Farm for Impact model puts cocoa farmers and other farmers in the driver's seat of development. The organization works with communities to invest locally generated revenue in both education and healthcare interventions. Shadrach has already won several awards for his work, including the Muhammad Ali Humanitarian Award. He's also the co-founder of the African Research Academies for Women, and he's founder and board chair for Students for a Healthy Africa. In addition, he was a trooper with the Pennsylvania Army National Guard, and he received his bachelor's in biology and his master's in nonprofit leadership from the University of Pennsylvania. Last month, Shadrach received the Gates Cambridge Scholarship to pursue his PhD in public health and primary care at Cambridge University. Shadrach, thank you for all of your important work that you and your colleagues do, and congratulations. Our annual YSPH Student Award for Outstanding Contributions in Diversity, Equity, and Inclusion, DEI for short, recognizes 2 second-year MPH students who have demonstrated a significant contribution toward creating and fostering a diverse and inclusive community while at YSPH. I am pleased to announce Helen Moore and Bethlehem Teshome as the recipients of the 2020 Student Award for Outstanding DEI Contributions. Helen and Betty received several nominations, both individually and together, not only for their tremendous service to YSPH as student diversity ambassadors and as champions for strengthening the school's social justice curriculum, but also for their tireless efforts to advance DEI across the Yale and New Haven communities. One nominator summarized Helen and Betty's contributions by noting, "From day one, they have advocated for inclusive communities and pushed to make YSPH and Yale more equitable spaces in closer coordination with the New Haven community." Among her many other roles over the past 2 years, Helen has also served as a graduate assistant at Yale's Asian American Cultural Center, one of 4 cultural centers at Yale. Helen was lauded for playing, quote, "a key role in creating a welcoming and comfortable environment for all students, and because her charisma and leadership are infectious." Hailed as a champion of advocacy, research, and community service, Betty has worked to advance diversity, equity, and belonging in and outside the YSPH classroom. She was recognized for creating inclusive social spaces for her peers and encouraging students to understand the importance of equity considerations and learn to apply these frameworks in their future careers. Helen and Betty, thank you for your efforts towards YSPH diversity, equity, and inclusion, and congratulations. The YSPH Teaching Fellow Award recognizes a student who demonstrates outstanding performance as a teaching fellow, or TF, and promise as a future teacher. The recipient of the 2020 Teaching Fellow Award is Alexandra Edmondson, a second-year MPH student in the Chronic Disease Epidemiology Department. Lexi was nominated because, quote, she is passionate, involved, and an excellent epidemiologist. The nomination submitted on Lexi's behalf spoke very highly of her dedication as a TF for the Biostatistics core course. Lexi, congratulations. The YSPH Distinguished Student Mentoring Award recognizes a faculty member as a leader in shaping the next generation of public health professionals and one who serves as a role model, conveys passion for public health, has clear and high expectations, encourages students to achieve their full potential, is sensitive to student needs and concerns, and finally makes extraordinary efforts to help their students. Candidates for this award are nominated by graduating students and selected by a committee comprised of students and faculty. The 2020 recipient of the Distinguished Student Mentor Award is Assistant Professor Nathan Grubaugh. Nate joined the faculty at YSPH in 2018 as an assistant professor in the Department of Epidemiology of Microbial Diseases, we call it EMD. The Grubaugh lab uses genomics to determine the emergence risk and to track the spread of mosquito-borne viruses, including Zika, chikungunya, dengue, and West Nile. Their goals in this lab are to integrate genomic data into surveillance and response programs to better prevent and control future mosquito-borne virus outbreaks. Nate has also been a pioneer in new COVID-19 work as well, helping develop the first test assay for the Yale New Haven Hospital. Nate has been described by his students as kind, positive, and an honest leader. The students praise him for his understanding and encouragement through all hurdles in the research process. The graduates value Nate's confidence in their work. They wrote, I am a better researcher, public health worker, student, and person for having Dr. Grubaugh as a mentor at YSPH. Nate, congratulations on receiving the Distinguished Student Mentoring Award for the 2019-2020 academic year, just your second year here on the faculty. The Distinguished Teaching Award, sometimes called the Teacher of the Year Award, is the school's highest honor for its faculty, bestowed by its graduating students. Quality teaching is one of the most important influences on a student's experience at Yale, and this award recognizes the recipient's leading role in shaping the next generation of public health professionals. The 2020 recipient of the Distinguished Teaching Award is Professor Marnie White, Associate Professor of Social and Behavioral Sciences at YSPH. She also has secondary appointments in chronic disease epidemiology and in the Department of Psychiatry in the School of Medicine. Marnie received her Master of Science from YSPH, and she also completed her postdoctoral fellowship at the Yale School of Medicine. She teaches courses on questionnaire development, psychometrics, and behavior change. She also teaches an undergraduate course in epidemiology and public health at Yale College. Our graduating students selected Dr. White for this award because, quote, she's 100% committed to her students and goes out of her way to make herself available to us. Marnie was praised for, quote, constantly being a source of knowledge, reflection, empathy, understanding, and kindness, and for creating a personalized learning environment that is crafted to best suit each student. To quote yet another student, Professor White deserves this honor and recognition as much for being a pillar of the YSPH community as for her truly exceptional dedication to her students' mental health, education, research, and clinical practice. Marnie, you are an exemplar of dedication to teaching. She is especially passionate about the vital tool of questionnaire development and validation, and this is her second Distinguished Teaching Award, the first one in 2014. As one of her students wrote, Marnie is not only an excellent researcher and academic, she is an excellent person who makes me feel closer to YSPH and my peers. I'm beyond grateful to have taken classes during my time here with her. Lexi, Nate, and Marnie will all have their names inscribed on the awards wall on the first floor teaching area at 60 College Street. Congratulations, Marnie, on receiving this well-deserved honor again. Our new Faculty Research Awards recognize distinguished peer review manuscripts published last year. The Early Career Investigator Research Award is given to a YSPH primary appointment assistant professor or associate research scientist within 10 years of their appointment, who was first or last author on a given published manuscript. Congratulations to Nate Grubaugh for his paper entitled Travel Surveillance and Genomics Uncover a Hidden Zika Outbreak During the Waning Epidemic. This was published in the journal Cell. Next is the Investigator Research Award, which is presented to a YSPH primary faculty member of any track or any rank who was first or last author on the published manuscript. And there was a tie this year in our first year of this award. Congratulations both to Professor Hongyu Zhao and Professor Zach Cooper. Professor Zhao's paper is entitled A Statistical Framework for Cross-Tissue Transcriptome-Wide Association Analysis. This was published in Nature Genetics. Professor Cooper's paper is entitled The Price Ain't Right: Hospital Pricing and Health Spending on the Privately Insured. The Quarterly Journal of Economics was the source of this influential manuscript. The Team Research Award is our final prize, granted to a YSPH team with 2 or more primary YSPH faculty members, with one member either being first or last author on the published manuscript. Congratulations to Albert Coe and his colleagues for their paper entitled Impact of Pre-Existing Dengue Immunity on Zika Virus Emergence in a Dengue Endemic Region, published in Science. YSPH co-authors included Drs. Costa, Hagen, Adhikarla, Wonder, and Reese, alongside 19 other authors from Brazil, Nicaragua, and the United States. We will also acknowledge the research awardees tomorrow in our YSPH faculty meeting and highlight the public health impact of their impressive research. Congratulations to all 4 of you. I would now like to take a moment to acknowledge our YSPH students receiving their PhD and Master of Science degrees from the Graduate School of Arts and Sciences here at Yale. We have 6 doctoral graduates and 20 MS graduates. We are most glad to include them in our virtual commencement ceremony today, and also want to acknowledge their participation in the Graduate School of Arts and Sciences commencement events. Please join me in recognizing them. We're nearly there. Class of 2020, the degrees you have been awarded today are a testament to your perseverance and your commitment to the field of public health. This is a wonderful accomplishment, especially in this challenging COVID-19 year. Congratulations again. I want to thank all the families and friends of the graduates for joining us in this virtual celebration that accommodates the exigencies of the historic and tragic COVID-19 pandemic. You have encouraged and inspired our students to achieve their goals. For decades, the public health community has warned the world of a pandemic respiratory viral infection threat. Alongside such fields as nursing, medicine, public policy, and economics, public health is proud of its role as one of the essential contributors to the welfare of humanity. You, our graduating students, have had a calling to secure training in public health. Some of you will go on to other fields, bringing your prevention perspectives with you. But most of you are joining our burgeoning public health academic and leadership communities. Based on my 4 decades career in this field, I feel confident in my view that you are privileged to this calling and that you will have a worthwhile career applying your skills to the prevention of disease and the promotion of wellness. We are sorry that we could not celebrate your graduation in person. There is nothing more more we enjoy this time of year than to share the graduation ceremonies with you. We've missed you all since your departures in March, although we've seen you online. The pandemic has catapulted the field of public health into the national and international spotlight. Public health is a noble mission. At this critical time, we are all called upon to offer our service to our communities and our world. At the end of commencement, we typically join together for photos and merriment. We want to offer you this virtual celebration that our Student Affairs team has worked hard to elegantly produce. Thank you to Dean Frank Grosso, Registrar Stacy Tuttle, and the entire team in the Office of Community Affairs. They have supported you for the past few years, starting during the application process and throughout your graduate experience at Yale. They made this virtual celebration and your graduation baskets possible, and it's taken a tremendous amount of teamwork in the past months to pull this off. Please join me in thanking them for everything they've done throughout your graduate training in preparation for your successful completion of your graduate work at the Yale School of Public Health. Don't forget to stay in touch with us and the AYAPH, our Association for Yale Alumni in Public Health. Let us know about the work you do. We look forward to hearing about your successes, your volunteering to receive our future interns, and we will always value your advice, support, and inspiration for the school. Stay safe, and do not hesitate to reach out to all of us at YSPH in the years to come. Thank you.